Hello and welcome to a very important and crucial discussion on calcium and vitamin D deficiency in India, bridging the nutrition absorption gap. Did you know that 3 out of 4 Indians are deficient in vitamin D? That means overall, over 76% of the Indian population lacks adequate levels of the sunshine vitamin. And this vitamin D plays a very important role in not just our bone health, but also in the absorption of phosphate and calcium in our body. It has also been found that 40% of the Indian population lacks in adequate levels of calcium in the critical growth years. According to a study done in 2023, it was found that 87% of the Indian women do not know the correlation between bone health and calcium levels in India. And that is why this discussion assumes so much importance. Today, we are going to discuss how vitamin D and calcium are linked to our bone health and how we can improve our bone health through lifestyle changes, through adequate diet, nutrition, and vitamin supplementation. And I have a very renowned and esteemed panel of nutritionists with me to discuss this important issue. I'd like to welcome our 3 panelists on the show. Geeta Ramesh Malhotra, RD, CDE, ND, Senior Dietitian at the Holy Family Hospital, Bandra, Mumbai. Welcome to the show, Geeta.
Hi.
I also have with me Humera Poonawala. She's RD, CDE, Chief Dietitian at the GHC Hospitals, Thane, Mumbai. Welcome, Humera.
Hello.
And I also have with me Pallavi Pinge, MPH USA, PG Dietetics and Applied Nutrition. She's the founder of Ambrosia Wellness, Diet, Nutrition, and Lifestyle Solutions, Mumbai. So I would like to open the discussion first with Geeta Ramesh Malhotra. And my question to you is, why is bone health so important? And what are the challenges in the Indian context for bone health?
Bone health is important for ability, overall strength, and quality of life. As we know that the body comprises of bone right from the head to the toe. Apart from storing calcium, it plays a very important role in protecting vital organs like the brain, heart, lungs, etc. Now, it helps in giving us structure as well as posture. It helps in maintaining that. Apart from it, it anchors the muscles. Now, along with the muscles and the joints, it gives us free mobility of the body. And this is known as the musculoskeletal system. Bone health is important is what the challenges that we are facing is there's a lack of awareness among the population, and therefore we see conditions such as osteoporosis, fractures which may readily happen, and some other musculoskeletal disease or issues may be there. Now, very common, which I would like to say today, that we are seeing in the population, that I think every household we may find one individual. One is having cervical spondylitis or the lumbar spondylitis. Now, these are all associated with lack of vitamin D and calcium absorption. This is because of urbanization, early menopause, lack of knowledge, inaccessibility to a balanced diet, lack of diagnostics tools which may be available in that particular area for screening, identifying, and then advocating a supplementation through not only the oral pills, liquids, or injectables, but after screening the diet completely, both go hand in hand to give an optimum bone health. These are few of the challenges that we come across while enjoying an optimum bone health.
For the next question, I'll go to Humera. Humera, in the Indian context, we consume a lot of milk and milk products on a daily basis. And we also know that calcium is associated with bone health, but still we have a calcium deficiency in India. What is the prevalence of this deficiency and why is it a growing concern?
Now, when you see in India, calcium deficiency affects rural as well as urban population. Considering the per capita consumption of milk and milk products, it accounts for almost 18 to 90% of total food expenditure in rural as well as urban population. Despite this, when you look at the calcium deficiency status, around 80 to 90 people in India are affected with calcium deficiency. That is usually related to poor dietary choices, poor food likes or dislikes, that especially among vegetarians, where the consumption of milk and milk products varies, and they do not take non-veg products for calcium intake. Now, because of this, there are many causes of weak bones, bone pain, fractures, osteoporosis. And yes, it has become a significantly high public health concern in India.
For the next question, I'll go to Pallavi. Pallavi, how are vitamin D and calcium linked to bone health?
Yeah, hi Richa. So now vitamin D basically enhances the body's ability to absorb calcium from food and supplements. Um, basically, when vitamin D is insufficient, even if there is a high calcium intake in the diet, it is not absorbed effectively because so basically, what we understand is both these nutrients need to be present in the proper proportion so that the body's ability to absorb calcium is efficient. Uh, both these nutrients need to be present basically for good bone health, and deficiency of either of these nutrients can lead to poor bone mineralization, increased risk of fractures, and osteoporosis, as well as weak bones. So it's very important that both these nutrients are present.
So as Pallavi said that we need both these nutrients, vitamin D and calcium. What is the right intake or what is the right dose of calcium and vitamin D that everybody needs to take daily? Geeta, if you could tell us.
Yes. Generally, in adults, they say that about 1000 to 1200 milligrams of calcium, as well as say about 600 to 800 IU of vitamin D is required. Now, having said that, honestly speaking, it is individualized. You require to do your lab work. After your lab work, your any other metabolic conditions are there, or you have suffered a polytrauma, or in general bone health is compromised, then you have to see a treating physician. Your physician will be the right person to decide your dose level. Now this varies for individuals, like among the children it is different, among adults, among definitely the demands are higher in case of elderly population as well as pregnant ladies. Apart from this, there are other conditions also where the demand may be high. It may be in certain malabsorption syndromes, in lactose intolerance, in certain milk allergies, where we need to take a proper diet history, see the blood parameters, and then decide what would be the therapeutic dose. After the therapeutic dose, what would be the maintenance dose, so that we can have a normal physiological response in the body. What actually happens is that vitamin D gets converted and is stored in the liver, and it plays a lot of important role in a number of biochemical reactions apart from just helping in the absorption of calcium. Now, if there is lack of vitamin D apart from the calcium, we may see deranged metabolic profile also. Hence it is individualized. Per se, honestly speaking, just in general, I'm saying that they advocate say somewhere around 60,000 IU per week for a period of say 6 to 8 weeks, and then 60,000 IU per week as a maintenance dose monthly. But having said that, this doesn't mean that the general population starts self-medicating. You have to do your lab works, you have to see a treating physician, your diet will be also like screened as to what it is lacking in, and along with that a supplementation will be advocated to you.
So Humera, we understand that vitamin D has a very crucial and vital role. In India nowadays, and in cities, a lot of people are staying indoors, working indoors, away from sunlight. How does vitamin D deficiency impact the bone health?
Okay, when you talk about vitamin D deficiency, almost 70 to 90% of Indian population is vitamin D deficient. This leads to bone pain, muscular issues, increased incidence of fractures among people. When we consider that the primary source of vitamin D is through skin absorption, that is sunlight exposure, limited exposure to sunlight, especially in the 10 to 2 p.m. slot when people are working, they are indoors, they do have uh, less efficiency to produce vitamin D because they're not in the sunlight. People who stay in cloudy areas or people who stay in cold regions, they do not have as much exposure to vitamin D or sunlight as much as people staying in warm areas. When you talk about darker skin, people who have a darker skin take more time to absorb vitamin D. People who are obese, studies have revealed that people who are obese have a less efficiency of converting this vitamin D into skin and using it. fat cells reduce the bioavailability of vitamin D or make it more insensitive for utilization. When you talk about age, with increasing age, the body's ability to convert this vitamin D into active form reduces, especially after the age of 50. And the limited food sources available is one of the primary concerns of vitamin D deficiency also.
And before I go to Pallavi, also people are not too keen to get tanned in sun, especially in cities.
Yeah. They use a lot of sunscreen. That they talk about UA exposure and skin disease, the UV exposure and skin disease, that is reducing our exposure to sunlight. So we do need to depend on other factors, other supplements, or other places where we can get vitamin D, apart from the dietary sources now.
So let's talk about the dietary sources now. Pallavi, if you could shed light on what are the good dietary sources of vitamin D and calcium for Indians.
Yeah, sure. So the main sources of calcium in the Indian diet, which is primarily a vegetarian population, it comes from dairy products, leafy greens, and fortified foods. There's another important point which is missed normally is plant-based foods are having oxalates and phytates, which actually bind calcium, and they reduce its bioavailability and absorption to the human body. So this is about calcium. And now vitamin D, basically in an active form, is mainly synthesized from sunshine exposure. So, and as Humera said, there is limited sources of food products. They are fatty fish like sardines, salmon, herring, mackerel. So these are the limited food sources along with fortified milk. Also, in addition, due to a faulty lifestyle, inadequate intake, dietary intake of these nutrients and poor absorption is the reason why which many Indians do not meet the recommended levels of these nutrients.
So the irony is that India has enough sunlight in most parts of the country, and still, if 3/4 of the country is vitamin D deficient, it calls for serious introspection. So is sunlight enough if one is deficient in vitamin D? Is sunlight enough for supplementing it, or do we need adequate supplementation in the form of pills? If I would like to go this to Geeta, Ramesh, Malhotra for answer.
Yes. In general, exposure to the sunlight is the most primary preferred source to get vitamin D, and that should aid in the absorption of calcium. But as we have already narrated before also, that diets which are inadequate due to some geographical reasons, depletion in the soil levels of inhibiting the absorption from certain foods that we take, supplementation to some extent becomes necessary, and this again has to be done after a thorough checkup. Apart from your biochemical reports, your diet history should be taken. Other factors that will come in the way are something like urbanization. Today, if you see in metro cities like Bombay, we have a rampant redevelopment which is taking place. People are having, corporate offices in high-rising buildings. There, somewhere around the sunshine is not able to reach, and hence we may see that these population people may be deficit in vitamin D, and hence the calcium absorption gets hindered. The other groups are that what I like to mention is that there are a lot of people today who are working in call center, and they have a night shift, and in the mornings they sleep. So if you really see this population, they are deficit in vitamin D to some extent. Apart from the cola culture and the refined food and the junk foods that we are eating, where is the optimum amount of nutrition, calcium that we are getting to maintain adequate bone health? Use of sunscreen, sunblocks, then it can be even early menopause. It can be, as we have mentioned already, the faulty diets. Apart from this, there can also be, certain cultural clothing practices which inhibit optimum absorption of sunlight, and therefore we may not get enough vitamin D, which helps in the absorption of not only calcium but also plays an important role in absorption and biochemical reactions of a lot of, factors in the human body.
So, Humera, why is it important to address bone health early on? And how can an individual ensure that he or she has strong bones from a young age?
Okay. Now, peak bone mass is achieved by the age of 30. That is why we lay stress on maximum bone density right from early childhood to adolescence. This will help us reduce the incidence of bone-related disorders early in life. Apart from that, we need to have an adequate intake of calcium along with vitamin D so that there is better absorption and utilization of calcium and better mineralization takes place in the bones. We need to have enough of physical activity along with weight-bearing exercises. We need to avoid excessive alcohol, caffeine, tobacco, and have in whole a very good lifestyle, a nutritious lifestyle to avoid junk foods. This is the key to having strong bones in early life as well as in older adults.
So Pallavi, are there any symptoms or signs that helps one detect that there is a calcium deficiency in the body or bone health is getting affected?
Yeah, so there are symptoms of poor bone health or calcium deficiency, which include muscle cramps, joint pain, brittle nails, fatigue, and an increased susceptibility to fractures. Now, long-term deficiency of calcium and the vitamin D may lead to osteopenia. It starts with osteopenia, can proceed to osteoporosis, and often it may go unnoticed until a fracture happens.
Also, one question on my mind, can nutritional and micronutrient supplements be a good add-on for bridging this nutritional gap of calcium and vitamin D for better bone health? Geeta, if you could answer that.
Now, supplements do complement a diet. There is a balanced diet. There is no doubt about it. Now, this is also, as we have discussed before, that it has to be individualized. It is depending upon the geographical region, access, early menopause, urbanization, and lack of access to a balanced nutrition and inadequate exposure to the sunlight. These are some factors which may help us support along with the supplementation after screening a diet history. Now, a balanced diet is a diet which has foods, in from all the food groups, whether it is your cereals, which is comprising of your like millets, they contribute to your carbohydrate, your proteins, your legumes, your pulses, your fats and oils, your ghee, your milk and dairy, your meat and fish, your vegetables and fruits, all along with a generous amount of water, which is highly individualized, contribute to give a balanced diet. Now, if apart from a balanced diet, there are certain nutrients which are also essential, which we have to keep in mind while prescribing a diet or a supplement, so that there is a holistic approach to enjoy optimum bone health. I'd just like to enlist just a few of them, just like vitamin K, which we acquire from leafy vegetables, which along with vitamin D helps in the absorption of calcium. Then there is vitamin C, which helps in bone renewal as well as maintaining the bone mass. Then there is magnesium, which is of optimum importance because we are today all talking about osteoporosis and fractures. So including magnesium is important to your foods as well as in the form of supplementation if it is required. Then there is phosphorus, which along with calcium forms a substrate called as hydroxyapatite, which plays a very important role in giving the the bones the hardness that is required. Then apart from that, there is boron, which plays an important role in maintaining the bone mineral density, and hence we may not end up having bones which are more brittle and porous. Therefore, encompassing a diet along with the supplementation, which is optimum, which will be required for an optimum and enjoying a good bone health.
Right. So we talked about supplementation. Let's dwell more on that. Humera, there are multiple types of calcium supplements available in the market. Is it important to choose the right calcium supplement, and how does it make a difference?
No, many types of calcium supplements, yes, they're available in the market. You have calcium carbonate, you have calcium gluconate, and so on. But not all calcium supplements are equally effective. We need to choose our supplements very wisely. They have a combination of calcium, vitamin D, and a few other micronutrients, as Geeta has said. We need to choose supplements with a higher bioavailability. Bioavailability means like if there is 1200 mg, how much of that, 40%, 20%, 30%, how much of that will be absorbed by the body? Then we have AAA calcium. It is an ingredient that is reported to have an increased calcium absorption along with vitamin D. Because of the presence of vitamin D, the absorption of calcium is better. The heated algal ingredient, present in these supplements is reported to increase the calcium absorption by around 57% compared to other calcium supplements. The algal ingredient present in these supplements is an amino acids. Amino acids are known to be absorbed by the intestinal villi at the rate of almost 95%. 95% of almost all amino acids are easily absorbed at the intestinal villi.
Are there any other micronutrients apart from vitamin D and calcium that support bone health? And how do they play a role in it? Pallavi, if you can talk about it.
Yeah, so basically, both my friends Humera and Geeta spoke about magnesium, phosphorus, vitamin K, zinc, vitamin C, boron, potassium, iron, which play an important role. But there's another amino acid called glycine, which plays an important role in collagen formation and synthesis. This glycine is crucial for maintaining bone structure, bone strength, and these micronutrients together, along with protein, which is a macronutrient, work synergistically to ensure that bones are strong, resilient, and properly mineralized. So while calcium and vitamin D form the foundation and for good bone health, presence of these micronutrients is very important either through a balanced diet or through supplements whenever the diet doesn't meet the requirement for an overall improved strong bones, flexibility, and good overall long-term health.
I have a lot more questions, but in view of time, we will wrap this very informative and engaging discussion with renowned nutritional experts of India. So we've understood how vitamin D and calcium play a very significant role in bone health. And we can address this growing concern in India through adequate nutrition, vitamin supplementation, and lifestyle changes. And I'm sure our listeners would have gained a lot of knowledge on how they can improve their bone health and avoid issues like fractures, joint pains, and other musculoskeletal problems. I hope this was a very meaningful and engaging discussion for everybody. We hope to see you again very soon.